We're now going to discuss some of the parasitic diseases. These are obviously also infectious diseases. Ascaris or ascariasis is Ascaris lumbricoides. It's the most prevalent parasite in the world. It's associated with poor socioeconomic status, using human waste as fertilizer, so it's in the soil. It kind of migrates around your body. It lives in the intestines, and remember, it does not attach to the intestines, so it really doesn't suck blood or cause anemia. A large infestation, however, can cause GI obstruction. They live in the intestines, but throughout their life cycle, they go through different parts of your body. They kind of will burrow into the intestines, work their way to the liver, and then go through the bloodstream into the lungs. They hatch in the lungs, and the larvae will crawl out of your lungs, and you kind of like cough them up and swallow them. Sometimes when they will burst from the lungs, you may have some hemoptysis, and that is called Leffler syndrome. You swallow the larvae, they then go back into the intestine, and they grow up there. Again, they do not attach to the intestinal wall. They simply swim against the peristaltic wave in there. They try not to cause symptoms. Remember, parasites are very happy living inside your body, and they don't want to rock the boat. Symptoms with most parasitic infections occur when you have a lot of them, and then you can't help but have symptoms. Also remember, for parasites, eosinophilia. We talked about NAACP, and the P was parasite, so you may have eosinophilia. You can identify them on smear. Some tests that you will use for parasites are going to be stool for ovin parasites. Remember that one all the time. You can identify the ascaris on a smear, and the treatment is going to be albendazole. Here is a nice coiled up ascaris. Goes all the way around. Nice and tight coil there. The hookworm also lives in the intestines, but the hookworm, there's two major forms in humans, the ancylostoma and Necator. Ancylostoma duodenale and Necator americanus. These do burrow into the sides of the intestine. They will stick there, and they will suck blood, and they can cause anemias because of the blood loss. They will be found in rural areas in warm, moist soil. They can cause an iron deficiency anemia from blood loss. They can pretty much suck up about a half a milliliter of blood a day. And if you have a massive infestation, that's a lot of blood loss. Again, look for eosinophilia, and you can see the eggs on the stool. So one of the best tests for parasites is going to be a stool for ova, cysts, and parasites. And here you have several hookworms in the intestines. The next one is Enterobius. Enterobius is the most common parasite of temperate climates. This is also known as the pinworm, Enterobius vermicularis. It is sometimes found in institutionalized patients. It also can run rampant in a family that has children. It does live in the intestines. The females will migrate at night, usually, to deposit their eggs in the perianal area. So that one of the hallmarks of Enterobius infestation is anal pruritus, particularly at night. One of the ways that children get infected is that they already are infected, and they can auto-reinfect themselves, because what does a child do when his bottom itches? He scratches it, and once he scratches it, now he's got it under his fingernails, and then he brings his hand to his mouth, and he just reinfects himself. So look for anal pruritus. Sometimes girls will complain of vaginal itching, because the females go to lay the eggs, and they kind of get lost and don't go back in the intestines. The vagina is not that far away, so sometimes the girls will complain of vaginal itching. The diagnosis, a really highly technological test is needed for this. You take a piece of adhesive tape, put it on the baby's butt, and leave it there that night. The next day you can pull it off, take it to the doctor, look at it under the microscope, and you can see the eggs. Okay? And that's how you make your diagnosis. And treat the patient, treat the family, and wash all the bed clothing. And here are the characteristic eggs of pinworms from a tape test under the microscope. And these are the actual Enterobius. They kind of are blending in. It's not really a camouflage. but they kind of go along that way, and this one is curled that way. Those are enterobius. They're not very long. Trichinosis is Trichinella spiralis, and it's worldwide. This comes from raw or poorly cooked meat, especially pork. The larva will live in the striated muscle fibers, and they can form cysts, and they are viable there for a long, long time. Classically, the presentation will be periorbital edema. They can have fever, and they can have muscle aches because that's where the cysts are. The diagnosis, you can get serology, or you can do a muscle biopsy and find the trichinosis there. So the arrow is pointing to them right there in a muscle biopsy, and here's another one. Trichuris is the whipworm. It lives in the intestines also, and it is very famous for causing rectal prolapse. These do not cause eosinophilia, and the diagnosis is made by looking at a smear, and they treat with mebendazole. And there's the whipworm, that whitish area there.